health problems. And kind of also agreeing with what Tasmia had to say about like training mental health counselors, for instance. Exactly. So to be able to bridge that gap in terms of supply and demand, because as I said, there's very limited supply of mental health services, mental health support, I guess, for professionals, while the demand is astronomical. We probably don't even recognize how big the demand is given the stigma associated with mental health, the taboo, the lack of awareness of depression, anxiety, bipolar disorder, psychosis, and so on and so forth, right? So I used to work for a public health research company and part of the mental health program. And the work that we would do is we would work on the supply side, so capacity building, and we would also capacity building entailed working with a lay health counselor model, where we basically brought on board individuals who wanted to work in public health, and we would train them about mental health illnesses, so symptom recognition, and like we would teach them how to provide uh, counseling by communicating with their client, right? So that was a program that lasted for 1 week or 2 weeks. And at the end of it, those individuals were then allowed to work on the field. However, they were supervised by a main psychologist. So exactly. So this was basically our solution for bridging that gap where the supply is too less to meet the demand. Simultaneously, I feel like it's also really important to like work on the demand side as well, so that communities, individuals, and even influencers within the community, right? We all have them in our community, especially if you go into underprivileged communities. For instance, we have health workers over there, or I don't know how it works in Bangladesh, but like we have you see people working for the councils, the local councils over there. So those people may have some sort of an influence on the community. So to be able to kind of tap into that resource and leverage them by seeking their help could also be beneficial. And of course, like if I completely agree, like younger individuals, because they're obviously going through they're younger, uh, they're being developed, right? So they're learning new things, and they're going through a very crucial age when you're young. So it's just very important to be able to provide them with that support so that they can address their these issues effectively.
Thank you so much. That is a very good point made, that we can obviously employ the people who are the influencers and who have already been working on the society. I'm really sorry. So uh, I have mentioned that in the chat as well. We'll move to Nimra. Nimra followed by Susanna again, and then we'll have Fariha. Okay, at Nimra, Susanna and Fariha.
Okay, so I would like to just add on what Shiza and Shiza just said. You know, we what I feel like is that the university students are usually going through anxiety most of the time because of there's a lot of pressure on them, right? Especially during their third year or their final year, because they're very uncertain about their future. So it 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 has to be like mandatory that every university needs to have a counselor. But like you said, कि हमेशा ऐसा नहीं होता. So what needs to be done is that the government needs to like start a program in through which get people on board who are willing to volunteer to spend some time with the university students. Um, so that because sometimes students they just want to like someone to listen to them to their problems, and even if like a university has a counselor, then what happens is the counselor can't just one or two counselor and students in thousands, and they can't just cater to all these students, right? So it's so there needs to be like multiple people per university who could listen to who could listen to students, and they should be willing to work voluntarily, because obviously not everyone is willing to work voluntarily. Um, so yeah, that's my solution to that.
Thank you so much. That is a very good point made. Uh, we'll now be taking the point that Zena, you wanted to make, then followed by Fariha, then we'll have Fortuza again. Okay, so obviously we understand the importance of having a counselor in the university, and not just in the university. We think, I personally think that there should be a counselor at a level where the college students are going to university, and that is the time where we face a lot of pressures and stress as well. That if either we would get in our favorite the university we are aspiring to get in, and we work on that, and sometimes if we fail, there are a lot of, you can say, mental hassle that happens within our brain. So we need to have counselors. Let me like summarize what Tasmia and I think Susanna and who else was mentioned that point. You did, Nimra, and Shida did. So what you guys want is, like, we can have counselor at the educational level. It is level where if we started from the students, we'll understand. I'm sorry. If we started from students from educational institute, we think that there is going to be lesser problem for people when they go in the professional life. So let's just have that we have two solutions with us. One is that we must have counselors in every university school or educational institute. Is that right? If yes, just give me a thumbs up. All right, thank you very much. So we have one solution, and the second thing is, to meet the demand, we can always have volunteers, influencers, medical workers, and people who are in this interns working for mental health and the NGOs. So we could meet the demand. We do not need the psychologists. We can have the counselors as well, general counselors as well. So if everyone agrees to that, just give me a thumbs up. Thank you so much. Now, Susanna, you don't agree to it.
Sorry for speaking. Your voice is sorry for speaking. Razi, your voice is very lagging and
Distorting.
it's not clear.
Oh,
Lagging. Yeah,
okay.
distorting.
Sorry.
That's it.
Sorry.
So I haven't heard what you ever said in last 2 minutes.
Okay. What is it okay now? My voice, is it better? Thank you. So what I said is, we have two solutions with us. One that was proposed by you guys, that we need to have counselors in every university or educational institute, right? Agree to that? And the second solution that was put forward was to meet the how to meet the demand. We can have volunteers, influencers, and general practitioners uh, working in NGOs to have the general counseling for these students, right? Do you agree? No, you don't agree? So you do this. If you don't agree, you don't, just move. Okay, Susanna, you were next. So you can go.
Thank you, Razi. Can you hear me clearly?
Yes, I can hear you clearly. Yes, I can hear you.
Okay, cool. Two things that I'd like to build on. Amazing discussion going on over here. Quite a few points I really resonate with. Thank you, everybody. So the first thing I'd like to talk about is the counselors in every educational institution, and I'm going to tell you this from personal experience. Is I think either Nimra or Shiza brought this up. Is that there are a lot of students for this one counselor or two counselors available on each campus, and it's not possible for one person to be actually going through this. Say you have 1,000 students in one campus, right? Just one campus, not even one university. One campus has 1,000 students. How are two people supposed to actually tackle this huge number? It's physically impossible, and you know that every other university student is going to go through some sort of mental unwellness, I would say. So what I would propose is also to have sort of mentorship programs where you have like peer mentorship, where say for example a senior student is helping out a junior student to go through situations that they've been through in the past. So, you know, it's just like a pay it forward program. I'm not sure if you know what I mean, but you basically pay whatever service was given to you. You basically take that into your own experience and pay it forward to somebody else, preferably somebody who's a junior in university. That was something that I'd like to raise. And I think I have gone through both systems. I've gone through the consulting system as well. I've also gone through the peer mentorship system. And I think the peer mentorship really, really works well. Having said that, I'd also like to say that why I am not not agreeing, but I'd like to disagree with having interns and general counseling being done by people in NGOs or people in different organizations who have had experience, is that I mean, it's easy for somebody to open up and talk to, but it's really hard to give advice on what steps to take, and that should come from a mental health expert and not anybody else, because you're actually taking the responsibility of somebody else's life into your own hands, and that itself is it's a very precious thing to hold. One single mistake is going to have them plummet down towards a step that you and the other person is going to regret for the rest of their life. So it's very important to only get counseling and proper advice and medication as well, of course, if needed, from mental health experts and people who have certifications. Uncertified people should not be giving out advices, should not be giving out medications, should not even be suggesting that, okay, I did this, why don't you do this as well? You know, this worked for me, that this can also work for you. That's not how it works. Everybody has a different journey, everybody has different levels of stress, everybody has different levels to cope with their stress and their unwellness or their mental health. And so every single person should be treated separately by somebody who knows what they're doing. Yeah, I am very passionate about this. Thank you.
Thank you so much, Susanna. So just adding to the discussion, there are a lot of things that I have a personal opinion about, but I don't want to impose that opinion on you guys. It's because of the reason that the whole conversation will be, you can say, centered by my ideas and not coming from you. So whenever I try to moderate a discussion, I make sure that I have the discussions from you people as well. A few days back, I've been working on mental health for like 1.5 years now. So a few days back, I was having a discussion with a trained psychotherapist from UK, and I had a psychologist on board as well. So they both were certified, we can say, counselors, and they were allowed to do the psychotherapies. So one of the points that came from the audience a lot was what Susanna mentioned, that there are a lot of people who claim themselves to be influencers of the society, and we being looking up to them for a lot of things, we a lot of time ask them about curious about our mental health as well, that we are facing this problem. So is that okay to seek help from seniors, from people who we think are influencers or who are not properly trained for this? So a answer that I got from both of people, both of the panelists that I had, was that to some extent there are some of the problems, like if it is related to our studies, that we are not able to you can say cope up to our the course burden that have been put upon us with the extracurricular, making our you can say resume. How can we do that? So a lot of things we understand, we can take advices from people who have done, but there are a lot of things that we need professional help from. So I do agree to what Susanna said, that we really need professional people rather than just having, you can say, some journal volunteer or someone working at NGO. So after that session, I had a conversation with one of the person, Fahad Malik. He lives in Islamabad and he also runs an online counseling thing. So I asked him about it. I asked him that because he himself is not a psychologist, how do he meet all the things that people need from him? So he said that I also sent him the copy of the conversation. So he, after that, made it mandatory for all the people who are working with him that they are not allowed to give any kind of advice to anyone, because that causes a lot of problem later. So then they hired professional psychologists on board. So yeah, completely agreeing to what Susanna said. So just had to make my point. We were, I think next I recognize Fariha. And I'm really sorry when I start speaking, I'm having a sore throat. A lot of words get missed. So
Problem. First of all, I'm really loving this whole discussion. Um, and the point I wanted to raise is that, Razi, as you said that at the age of 18 and when we have to choose a career, a lot of people feel stuck that they do not know what do they choose or what do they opt as a career. So, and I have been through that I have that personal experience because I chose a career that wasn't meant for me, right? And I felt stuck for an entire year. And there was a friend of mine who lives in US, and she, in a normal conversation, she just told me that she's going to a career counselor who's guiding her to choose a career and calculating reasons why she should opt a career. So I think, first of all, the thing I wanted to point out is you all know that in Pakistan, recently there was a reduction in educational budget, right? So if we are not, because of which a lot of universities were scrapped off from some of these scholarships, right? So if you're not allocating a sound budget, how are we supposed to hire counselors? So I think there should be a sound budget allocation in that department so that we can hire counselors, so people can make right career choices, because it is not affecting them for 4 years or 5 years. This career is leading them towards everything else, right? The scholarships afterwards, or a job. So I think there should be a sound budget allocation in this department. Thank you.
thank you so much, Fariha. That is needed, of course. When we'll be drafting a policy, we have to understand that where the finances are going to be coming from. We understand that government need to put in more efforts in addressing the problems, as Arman said. So as Susan as well said, so yes, uh, that is mentioned as well, Fariha, that we need governmental policies for uh, budget allocation for the policy. Yes, Tasmia, I think I have recognized someone before you. Have I not? Just give me a second. The message went up. No. Yes, you can speak, Tasmia.
Okay, also, just to add to all the points that everyone's saying, especially Susanna Apu, because like what she mentioned is very, very important and true. So just to clear it up, there's like a big difference between like a psychologist or a normal counselor that we have at our schools or universities usually, and a clinical psychologist or a psychiatrist, because they can prescribe medication. So psychiatrists or clinical psychologists, these are professionals who are allowed to prescribe medication. These are professionals who are more expensive to hire, and these are professionals that are not really found in our countries right now at a very high rate. Like we have a lot of doctors and nurses for certain diseases, but we don't really have them as much. So there's a big difference. And when I said like, that you could hire people and train them, what I meant is basically like not train them to prescribe medication or give advice per se, but more so to make it like a safe space to talk, just to open up. Because opening up, talking about it is one of the key things that a lot of people just don't want to do. A lot of people are scared of doing because of all the taboo behind it, because of all the shame that is associated with. Like I also mentioned in the group chat that like, like universities have clubs and societies, so you could create like this support group that could come together, and it's not necessary that everyone has to talk. Maybe there could be one person who could share their experience so that others could understand that they're not alone. So the biggest thing to recruit people, to recruit volunteers or NGOs or any other organization, or provide that vocational training to them, is so that they can raise that awareness, so that they can talk and make people understand that it's okay, to talk about it, that you can open up. I would definitely not say that, like, an intern or someone who's not professionally qualified could prescribe medication or should give professional advice. And which is where the training comes in, because the training would essentially have to train them into talking and then advising them to visit professionals, actual professionals who can prescribe them with the medications, who can prescribe them with actual logical, legit advice regarding their condition. The only thing that like trainees or like interns can do is basically listen and take it in and maybe create like a small report that they can forward to a government appointed professional. So that's just what I wanted to add.
Thank you very much. Everyone agrees to that. Uh, I'll move to Murtaza because Murtaza have raised his hand first. But after that, I would really be wanting to hear from Usman and Mehak because you guys have not spoken anything in the whole session. So, Murtaza, you have the mic for now.
Thank you very much for giving me the floor again. As we are coming up with different solutions and the solutions for problems, I think we missed one part here. We missed the use of media. Media has a really big impact on a nation. I can give you an example. Recently, I watched a movie. It was from India. The name was Chichore. So this movie has actually taught me this. This left me with a lesson. So media has huge power. It can divert a nation. Like you can like change the mentality of whole nation with a movie. So we can use this media for that. I mean, you don't even have to spend a lot of money. We are here looking for psychologists, we are talking about counselors, it obviously takes plans and it is a long term process. But you see, there's one movie that changed my mind. I watched it for like 2 or 3 hours, and boom, I am changed. Like the success is it's about your happiness. We have to teach our next generation that if you're happy, it's all right. You don't have to care about the success. You don't have to be rich. So that movie actually left a really huge impact on me, and I would like to add something more with that. You see, there is always a competition between in international platform. There's competition between the countries, like which countries has higher economy rate, which country has a higher literacy rate. So this can be set as a trend, at least for the South Asian country, that which country has the higher mental health rate. So this can be a competition. We can set this as a trend. So I think we have to focus there. Like you see, Asian countries actually suffering. We are discussing about Asian countries. So let's set the trend over here. Let's start it from today. Like we are over here like 14 participants. We are going to promote this, and like 14 will be for 1400, then will be 14,000, and this can change. So these are the two topics I wanted to mention. Thank you very much for appreciating.
Very points, very well made. Thank you, Murtaza. That needed to be said, and I would have said it in the later part of the conversation, but you said it before, so thank you very much. Yes, I'll have Aisha. Then we'll have Shizar say something, and after that, Mehak and Usman, you guys have to be ready because you will be giving a small stance. You can say your part in the conversation. Yes, yes, Abdul Razak, you were
Thank you
last.
so much. Thank you so much. I'm going to add something like Murtaja is saying that social media is, I think so, a big key and a big platform that government should utilize it. And yes, we can spread this the mental awareness by using the commercials like social media. Today's genre is totally based on social media, I think so. The Facebook, the Instagram, everything. We can government can use these links and the spread about mental health, and as well make different dramas. The whole society is very much influenced by social media. I think so this they can use these things so point, and I think so it will be become a big change if it will be the main point. I think so, and Murtaza has done a very good job, and this is the best point, I think.
Thank you so much, Aisha. We'll have Mehek followed by Usman. Mehek, can you hear us?
Hello, Razi. Can I speak?
Yes, sure.
So let me just, everybody is saying good. I just agree to many of the points that many of are mentioned. But right now, I'm pretty much concerned about the policy. All the points will be concerned about the policy making. You can just note down my points if you feel it's good, or we can discuss more about it. Firstly, we are you can say the shoots of a tree, but we are not considering about the roots. I believe that starting from school, the student should be necessary step that should be taken. Now I cannot set pretty much counselors the counseling in my school, but what I can do making, I can make a schedule,
Mehek, your mic is
or
distorting a lot. I think you are having connectivity issues.
can
Mehek, can you please write that in the chat so you can see we can understand that your point is very important to you and you really want to hear it as well. But because we are having a connectivity issue, can you just put it in the chat? Thank you so much,
okay.
Usman.
Okay, thank you so much. I'm sorry for this internet.
What she said was thank you so much, and I'm really sorry about my internet. Okay, Usman. Usman, can you hear us?
Yes, I would like to agree with the point that we should have counseling in our university, in our colleges. So if we see in the outside, in other country institute, there is a separate department of there are general counselor who guide the students. Other than that, I think as compared to the uh, if we see according to the brown people and white people do take mental illness and mental health very seriously, whereas in our generation, in our country, it is not looked that much. So there should be much awareness and according to the adult side, I think we cannot make them that much aware, but we can start from the youth cycle. There are certain programs and there are mentorship programs, but this should be implemented in the course outline in the college or institute. So everyone should get to know more about the mental health issues, and so people can help it. So that's why the counseling is a really good, and a professional person should be assigned for the counseling rather than interns and that. So my points is in some points are similar to the others as well.
Okay, thank you so much. Thank you so much, Usman. Points are very well made that we need to inculcate it in the, you can say, education system of from a school level. So, all right. So I think we have pretty much covered the. Now we are like repeating the points where we started off when Tasmia said that we need to have uh, let's say a new course outline regarding the mental health introduced in school, colleges, and universities. Then we went forward to having this conversation at universities as well, having counselors and having safe spaces to talk. And then the next we had was the next point we had was how we are going to be meeting the demand. We are going to be having counselors in universities, the workplace as well. We have counselor support system from school clubs and society. So that is what pretty much all of the discussion sums up. So I'll have the last point from Abdul Razak, and then we'll move to the other part of the discussion.
Thank you for giving me the chance. It was very late, but anyways, points are very lovely. All of you, some points I agree, some points I don't. Just like that, mental illness is different for different stages of people.
in my point of view, that we have the same emotions, we have the same depression, anxiety. We can have different problems, so and the impact of it is the same. The thing is that when we talk about the youth, especially the age of 18 to 35, we forgot a very important thing, that we don't have enough time. We literally don't have time. We have assignments. I literally have 3 assignments pending now. So we don't, who will wait 1 hour in a line of a therapeutic session for what kind of impact will it does to him? And the most important thing that everyone is forgetting, that the importance of family. We are forgetting that we live with them and we spend most of the time, our weekends, with them. So we need to create an impactful way to guide the parents or the families or the loved ones or the friends, that how can they impact our situation, how can they impact our mental health, how they can know the what kind of behavior we are going through, what kind of phase we are going through. And the second thing is that they talk about the supply and demands, that we should supply counselors or therapeutic situations, but we forgot that we could just order. We are the government, right? The private companies who are making millions or billions, maybe whatsoever, they could at least hire a professional counselor, couldn't they? If we just made it a compulsory that every private company could hire a professional therapeutic counselor, and it is a must that every employer, mostly especially the law enforcement agency, who deal with the most traumatic situations ever, have a at least 30 minutes of therapeutic session. And if the therapist, if the psychiatrist allow him to work, then he could work. Or if does not, then he has a serious problem. We could do that. And the last point that I will do that about the youth is that we are generally more about the university level. 18 to 24 is mostly the level of university. We could at least, if we could hire counselors, professional counselors, and you can, you wish that there are, just as Suzanne said, there are many students, thousands nearly, who one psychiatrist have 1,000 students to deal with. Yes, we could do just one thing. We could make mental health subject compulsory for everyone to at least do just 1 semester or 2 semesters, that we could get a basic formation of what mental health is and how can we deal with it. Thank you.
Thank you so much. Do everyone agree, or anyone who want to disagree to it? Everyone agrees. Thank you so much. And thank you so much, Mehvet. Your points are very well made. We will make sure that I document them as well. So next we'll have the conversation. I would really want the conversation to move forward. We can come up with something related to adults as well. Adults, when I say adults, I mean people who are 30 and above. So like the generation that is above the youth. So I don't actually remember the exact word that is being used in the policies right now. So people above 30. And I really would have wanted to have a more fun conversation with you, but this topic dictates me to not be fun, because I understand how important this is and how seriously we have to take it further. Otherwise, if it would have been any other topic, you would have seen the fun side of Razi as well. So Abdul Razak remembers me. He have been my delegate for 2 MBN, so he knows that I am not this serious when I do the count cheering and all those things. So, am I not audible, Murtaza? You have been very close to. Okay. So next we'll be moving forward to the problems and why they are causing the problem, or what is the problem with them. So I'll start off with something that I have seen, so the conversation could go forward. What I see, that the generation before us was not very connected to each other, because they were not very socially active, and they did not had the social media the way we have the access to it. So what I see is that in those times, the generation that is above us did not know what the mental health is. What are the problems with the mental health? When I say that in Pakistan, and the work that I have been doing was mostly about the abusive marriages and abusive relationships, and women coming from lower income backgrounds with lower literacy rate. So what happens is that they don't even know that what's happening to them is wrong, and that's causing not just causing problem to them, but to the people who are there bringing as well, to the children who are there bringing as well. So that is the problem, that they did not have the access and they did not have the awareness of the problem. So what do you think about that? So we'll move one by one to everyone now. So anyone who want to willingly speak first, please. Okay. Tasmia followed by Murtaza. Tasmi is power delegating right now.
Okay, I just have a
Raj,
lot to say, you know.
sorry for interrupting. There's a azan going on. Can we pause for a minute?
Okay, sure.
Thank you very much for your patience.
Yes, Tasmi, you can go on.
Okay. Thank you. So basically, I agree with what you said. Connectivity is a very big thing that our parents or the generation before them didn't have the way that we have. So, but now, since they actually have it, most people have Facebook on their phone. Like my mom uses it like she's addicted to it. So I really think that, you know, how Facebook has these ads that they target, and like, you know, Facebook will always have these ads popping up in the corner as a notification. I really think that if these ads could be utilized to raise awareness regarding mental health, we could slightly educate them a little bit more. I really think that if um, you know, our parents constantly kept seeing that, then they would know that okay, this is something that might be important, that might need some addressing to. So that is one solution that I think we can utilize, is targeting these online ads that are, you know, that are so crucial in spreading information. And apart from that, I also like, I don't know if this is going to sound like a very radical idea, but I also think that both our countries are quite religious. I don't know if you agree with me, but we do stand religion in a very strong way. We do follow our religions very strongly. We do like have religious influencers who have a very big platform on both countries. So I believe that, you know, like my mom says that Islam is supposed to be a peaceful religion. So, like, if you really want to spread the message of peace, then I think that we could utilize these Maulanas and the religious scholars that we have, and they could also spread the message that, you know, like, if you're facing these problems, it's okay, you're not crazy, you're completely all right. You should probably seek professional help. And these are some of the steps that you might be able to take to seek professional help, to go to the appropriate government institutions and all that. Because I see my mother, my father, my relatives, they all like, you know, they all hear to these religious sermons and all that. So in that sermon, if you can just like put in that one line that, you know, that maybe if you're feeling this way, it's okay, you can pray, but also do this, that could help a lot, utilizing a platform like that. So that's what I wanted to add.
Thank you so much, Tasmia. When it will be coming
Okay.
from WhatsApp and Facebook, our parents are definitely going to hear that, because they do not even understand that what we are saying is right, because it's not coming from WhatsApp and Facebook. And I completely agree to what you said. I have been trying to address this issue as well. That why can we not use the religious scholars to solve our problems? Like, just for a small thing, why can't we use if someone from religious background stands up on the member and then he says that if you break a signal, it's going to be a sin for you, because it puts your life in danger and life of anyone else in danger. So coming from that will be a very different impact than rather than coming from a person sitting on TV and saying that don't break the signal or the government policies, because half of the population already hate the government or the politicians that are representing them. So yeah, points are very well made, and that had to be said. Thank you so much, Tasmia. Who was next? By the way, I'm loving how the conversation is going forward. Yeah, well done to you guys. You are doing an amazing work. Yes, Murtaza. And yes, thank you, Mahvish and Mehek, for your points. You have mentioned some really good points. Yes, Murtaza.
Thank you very much. I totally agree with Tasmia's proposal, as she said that we can use the religious scholars to convince our parents, as they as many of them are actually convinced easily by those Islamic scholars. There is one thing over here in Bangladesh. I don't know about Pakistan. You see, there is madrasa. There are madrasa students. So usually what happens when we are in school, we studied in a school, but madrasa students are from a totally different background. So they are not introduced to the things we are introduced. So we have to make a platform where the mental health of madrasa students are also focused, because they are also human being, right? They also have mental health. So this is our responsibility as a human being. We have to actually go to them. We should ask them, hey, do you need help? Maybe a madrasa student wants to be very fluent in speaking English, but for some reasons probably he doesn't have a good English teacher. That's why he doesn't get to practice English. Maybe this is why he's lacking confidence. So probably we can go and help. This is just a scenario, and this by this point, this is also focused that we have to increase the real life interaction, because we are talking about social media. How long can you spend in social media in 24 hours? I won't consider those people who are addicted to social media, but I will be considering those people who are still under their parents' guidance, the children who are studying in school. So they are not that much what do I say, that much familiar with social media. They do not use that platform that much. But if we can increase the real life interaction, maybe by teamwork. Imagine the 14 people over here, we were playing in a field. We were probably playing cricket. We were having a teamwork, and that was physical. That would be more effective. But we are grown, we understand that. But the real life interaction, I think it's more important. Thank you very much.
Thank you very much, Murtaza. That is very important, and please appreciate everyone. And yes, Durlab have mentioned it in the chat. So if you guys could see it, that here in Pakistan we are working on one curriculum system. So we can obviously include the education of well-being in that, if you guys come up with a good solution. So yes, Aisha, you have been raising your hand. I saw that.
Okay,
And
sorry, I can't hear you because I'm facing some internet issues. But the thing is this, that Murtaja is saying very right thing, that madrasa is a very good way we can spread our mental awareness as well. And as I'm medical student, so I can uh, talk with the depressed patients as well. So I've seen them that they can't even talk, they can't even eye contact with other person. They don't know how to talk with other person. So I think so they this is a very big thing that it should be addressed. And I think so in every part of life, in every age, someone is having some issues in their life. Okay, so it should be addressed. And I think so the communication is the best thing to talk, to express what they feel. So I think so we should have uh, the government should have aware them that the communication, the talking is very important. Not just to don't speak and like this, you have to spell what you are feeling. So I think so the government should take a step in this and aware about that what is mental health. and I'm lifting now because my internet having some issues. So this is my last point. Okay, and it was a great experience by you, and all of them are very good. And thank you for so much for arranging just a best one. I think so. Thank you so much. And Razi, you are also very good. And I don't hear you right now, but
Okay.
I'm saying thank you
Okay,
so much.
you need to thank the youth embassy team for that. They have done all the work. We are just here facilitating you. So yes,
Everyone is best on their plan. Please.
thank you so
Thank you
much,
so much.
Aisha. Thank you so much for the appreciation, your kind words. Yes, we completely agree to what Mehvish and Arman have been saying in the chat. I have noted that as well. Thank you so much. Who was next? I think I recognize someone. No, I did not. So anyone who want to speak next, please put your flag card down, USA. Yes, Tasmia.
Okay, so this other thing that I wanted to talk about is well, like you can't really, since our parents, our grandfathers, our aunties and uncles are already done with their education basically, you can't really implement the education system into their lives right now. But what you can do is either amend existing policies that the government has, or add new policies that include these rules regarding gender roles. Like, um, I don't know if I can explain it very clearly, but basically, what I mean by gender roles is that, you know, how we have a very male predominant society, and that leads to a lot of these problems that our parents, our aunties, uncles, grandfather, they're facing. So I believe that if the government could make a set of rules, or at least just one rule that would distinguish between the gender roles that a woman has and a man has, as not being separate, as them being equal, then it could make a huge impact. Because when you do that, then, you know, you were talking about how there are abusive marriages and abusive relationships. Like, these do, like, mental health issues do stem from these issues, right? So if the government had more strict rules, or like, you will see in the developed countries that, like, you know, if you beat your child, you automatically be sent to jail. You might spend the night at jail just for hitting your child. And our country does nothing for raping and killing women. So I mean, like, if you could change those like nitty bitty things in the rules that we already have, or add a few new rules to the gender roles that our society has, it could make a huge impact as to how adults would view mental health. Thank you.
So to put that, you can say boil that down. What you mean is that we need to make the government review the policies and make those policies gender neutral. Is that right?
Yes, yes, make it gender neutral, and also, like, you know, introduce the set of rules that will not allow you to abuse, will not allow you to get away with abuse, because we might have them existent already, but they're not being enforced. Like, there is a reason that right now, like, you know, the country that I'm in is doing so well regarding COVID-19, and Bangladesh isn't, because they've followed these rules. The government took action. Our governments are only talk at most times. It might be blasphemous of me saying this, but it is quite true. We talk a lot, but what has really been done? So if the government can really put in that little bit of effort to actually take action regarding something that's so small as just preventing abuse, then it could make a huge difference as to how adults view mental health. Thank you.
Thank you so much. Points well made. Anyone else want to add? Nimra, do you want to add something? You haven't spoken a lot. Nimra and Fariha, followed by Abdulrazak. Okay, if you guys are not going to be speaking, then Abdulrazak, you go first, and then followed by Fariha. You will be speaking next, and then we'll have Nimra.
Thank you for giving me the chance. Not sure what to say because many points which I was going to say have been already made. But the thing is about the point where Tasmia has mentioned about the gentle nutrition. Well, it does somehow create an impact on mental health, but it does not specifically related to mental health. Yeah, when you talk about the abusive marriages and other things like child marriages and other things, they are more specific like perceptions of people. Like they do think it's wrong. It's not related about the mental health. It's just there some kind of trend or we can say culture. It exists. So moving on, when we talk about the people more than age of 30 or 40, we see that there's a drastic change of socialism. They do communicate outside of their community or outside of their friend zones. We see that the thing is that we could use that the more people that are older than 30 are mostly religious, we can say that, and they are usually goes to imam and dargah वगैरह. We can use that platform to create a discussion environment. Like as we see in movies like in American series, we can see that there are people holding around a chair and use and discuss what their insecurities are to everyone, and they relate that yeah, you can do that and you can do this, yeah, we can hear you, we all been through this. That we could relate that masjid, that the platform we have is so amazing that we could use it. And the other thing that we mostly forgot about the people of old age, that they require more attention, not from the outsiders but from us, their sons, their daughters, their relationships. We are their source of we can say we are their pills of mental illness. We can create a much impact to their mental health as any counselor can. The last point I can say that the religious scholars that we have, we could create a meaningful group of religious scholars that can only talk about the mental health in our country and in Bangladesh. That we are so religious people that we definitely listen to them. We will definitely listen to their ayahs, their hadiths, and all of the things, and it will create a great impact than anything else. Thank you.
Thank you so much, Abdulrazak. Points very well made. Obviously, we can be using that. Now, since we are running short time, and you guys have to get back to the room, so I'll just have a quick point from Fariha. Jo.
Thank you so much. There's something I wanted to share and highlight. Was that when parents are conceiving a child, right? So they're not aware of their responsibilities. For instance, they try their full to fulfill their physical needs and financial needs, right? But they're not aware of the emotional needs. There is this theory of Erikson, which I studied in my psychology minor. That was that an individual goes through different stages of psychosocial stages in life, and when each stage goes through a successful completion, that individual have a healthy personality in healthy personality, right? So when their parents are conceiving a child, they should be giving a counseling, like prenatal counseling, where they should be informed how a child should be raised. So that is the point I wanted to bring in the notice. Thank you.
How to raise a child? Very good. Points very well made. Yes, we'll have a wrap-up session now. It's almost Maghrib. Yes, we understand that. So just completely coming back to everything that we have studied. Now, obviously, when you guys will going back, there are a lot of points that could come to you. So we'll discuss that first in the first half of our conversation tomorrow. So what I want you all is, when the session ends, you can look up to the policies that have been existing previously, and when we draft the policy tomorrow, we could use them as well. The session was very nice and very good. If someone could just summarize what we just said, what the whole thing that we have discussed. Everyone left you.
I guess Tasmia.
Everyone have left you, Tasmia. Have you seen that part
Okay,
of
why
Harry
does
Potter
it always
when?
have to be?
So have you seen that part of Harry Potter when Hagrid asked them that who would be riding that flying horse kind of thing with a beak? I don't remember the name. And everyone goes back, and Harry's left in the front. That's what happened with you right now.
Okay, so basically, to give a summary, is that everyone came up with wonderful solutions that do need a little more editing. But what we talked about is how mental health has affected so many aspects of society, and like, even like at a personal psychological level, like how it has affected us as individuals, and how we have derived that experience to come up with these solutions that we think would work. And we have divided how mental health affects individuals into certain groups, like going from youth to adults, and how youth are affected differently from adults, and how, like, the solutions should be different as well, because like you can't really target a youth uh, group at the same way that you can target a group of adults who are facing mental health issues. And we also talked about how we can utilize very different platforms, like religion, for example, when it comes to adults, or social media when it comes to both of them. And we also talked about, oh my god, we talked about so much. But we also talked about how we need to like focus on education a lot. We need to focus on proper counseling. We need to focus on training. We need to focus on actually recruiting professionals. We need to focus on re-implementing or implementing new rules by the government. Like this is the gist of it.